welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, and I am super excited to have Dr. Anna Elperin on our show today. She's a doctor, of course, and she's going to be discussing alternative income streams for physicians. So without further ado, Dr. Elperin, welcome to our show.
Thank you so much for having me, Shawn. It's been a pleasure to collaborate together through the time that we've known each other.
Yeah. So tell us a little bit about your background and then what you're doing now.
So I'm a DO by training. I've done a lot of musculoskeletal health in the past. Finished residency in Eastern Washington in 2017. And just the mountains, I think, captured my heart. So I stuck around and had my own practice from 2018 to 2023 in Ellensburg. And from that point on, just kind of wanted to, as much as I love clinical day-to-day patient care, I kind of realized that burnout is real.
Yeah.
And seeing 30 patients a day every single day is not a sustainable solution for long-term longevity of any physician. So at that point, I just kind of wanted to pivot and find something that I can still do the work where I provide a benefit to patients and collaborate with physicians, but at the same time, also kind of think of my own health at the same time.
Sure.
So kind of started looking at different options, what else is out there. And turns out there's a lot out there for health professionals that can bring kind of a balance of the two, where you're still doing some clinical care and maybe doing some patient care, but at the same time, you also have income that you can reliably fall back on and provide for your family and pay off your student loans and all of that kind of stuff.
So tell us a little about the program that you're talking about.
So I started working, the first company that I started working with, I kind of fell into. It was a program that a friend of mine has been doing for 30 plus some years. She's a Ivy League educated neuroscientist. So when she started talking about what she is doing, and I've known her for almost 10 years, so shame on me on not kind of like learning about it sooner. But we kind of met at a party through friends and we've known each other. And then about a year ago, which was a particularly difficult time for me, physical health-wise, I was struggling. She was like, you do understand that we've been with a Juice Plus company for 30 years. And I was like, I actually didn't realize that. So Juice Plus company I almost struggle to call them a supplement company because they've been providing their formulas in such a way so it's we call it better than organic. Nothing is manufactured in the lab. So we are truly a company that takes the freshest fruits, vegetables, and berries and plant-based omegas. We flash freeze them right as we capture them from the farms. Everything is manufactured in the United States. And we turn them into powders. And over the years, we've learned that people don't necessarily like to drink it. So we started to encapsulate them, and we produce fruit, veggie, berry, and plant-based omega capsules for our patients. We're the only company with 30 plus years of proven track record of having university-backed research, which means that we don't Once the university decides to do research, Juice Plus Company has nothing to do with it. So we can't pay for it. We can't control
Right.
outcomes. We can't like this is all third party based, and it is a lot of the studies are placebo controlled, double blind, randomized. So we've shown results that we reduce rates of heart attacks, cancers, cardiovascular disease, improved brain health, anything and everything that you can think of. So as a it's not only available to physicians, available to all health professionals. You don't necessarily have to be health professional, but health professionals, I think, in my eyes, do a little bit better with that. So there are a couple of ways of interacting with this company. You can become a distributor where you just have clientele. You know, a lot of times we work with physicians, nurse practitioners, physician assistants offices that just kind of feel like they need to bring something like that into their office and they just don't know where to turn to. So we become kind of like that turnkey solution for their offices as far as, well, there's no buy in. It costs $1 a week to become partners with us, which is, I think, a fantastic opportunity
Yeah.
for becoming a new business owner. And we take care of all of the end for them as far as you don't have to stock inventory. You don't have to have those costly per month deliveries into your office every single week. And you kind of start stacking up those dividends at the end of the month, which as as a physician, it becomes a really amazing opportunity to kind of slowly start earning those gains, and it is yearly uh, profit that you're making. So once you kind of build up that clientele, you kind of build your online business, that becomes your yearly, year after year after year. You don't even have to think about it. You kind of just wake up in the morning and check your monthly account, and that money is kind of there, which for a lot of physicians, yes, we love taking care of our patients. We love taking care of our clients, but at the end of the day, we also want to be able to take care of ourselves and our families. So
Absolutely.
having something like that built into a profitable business and with our credibility of 30 plus years, we just gained our new CEO, Mr. Garza, who I'm so excited about. This guy, I think, is going to be fire for this company. We also built a what we call a Juice Plus community around the world where we truly take care of each other. And you don't have to be a healthcare professional to kind of join the company. Um, I think my mission is to bring more health professionals into our Juice Plus community because I just don't think that enough people know about it. So that's number one. And the other company I recently started working with would be specifically for health professionals. Um, so it's funny how these things happen, how sometimes you just kind of run into people in your life and you don't know where these relationships will kind of take you. So we met probably 6, 7 years ago, somewhere in California. I was on a health care convention, and we kind of just fell into knowing each other and kind of stayed in touch over the
Mhm.
years. And so, what this company is doing is another service that is very much needed and is lacking currently from healthcare is remote home health care management, meaning any provider who is considered their primary. So it could be nurse practitioner, it could be physician assistant, it could be physician. Um, if they have a substantial base of Medicare patients, and we all know that medication non-adherence, this is where your expertise comes in as a pharmacist, um, and lack of communication with their primary care service provider is the number one reason for readmission to the hospital or ER visits. So remote management of home health care, which means that each office is assigned a dedicated medical assistant, or it could be more than one, depending on how big their office is, who is able to take care of those phone calls of medication questions and so on and so forth. They have a proven track record of reducing ER and hospital readmissions or usage of the ER system by 64%. And
Wow.
Medicare is very happy to pay for it. So this year, I don't know how many of you guys know, Medicare is reducing their pay by about 9%. So what they're doing, they're taking that money away from reimbursements for regular office visits, and it puts it into programs like what I'm talking about, remote care management. I think that's going to become more and more of the thing in the future. So as we all know, people who are managing their patients who are Medicare providers, reimbursements as is are not a lot to speak of. So when you take that and you reduce it by 9%, but you start looking into other avenues of how can I serve my patients better? And at the end of the day, we have this company has been around for almost 10 years. We have 10 years of proven track records of we improve patient care, we reduce hospitalizations, we keep our seniors in their homes for longer, being independent and healthy. That's the key here. We don't.
Yeah.
That's and at the end of the day, we provide a pretty substantial bottom line to the patient, to the physician's office. So, being very conservative, I can say that we can probably add, and that's to any physician who has at least 2,000 patients and more. And that's majority of primary care providers. We can probably add $200,000 or more to their reimbursement per year.
Wow.
And that's us doing all the work and taking off the load of their staff because now we are taking care of all of the phone calls. And everything is done within the protocols that whoever that provider is sets for us. So we don't dictate of how the care is going to be provided or how, what are the monitoring system that they want. We really walk into the office and become like an extra arm of your office at absolutely no cost to the physician and no long-term contracts. The only thing we ask is if we walk into your office and we start working with you, give us some reasonable amount of time, at least 3 months until you decide yay or nay, because it takes time to kind of implement all of those systems.
Mm-hmm.
And if within 3 to 6 months you're not happy, you just say, I don't want to do this anymore. And we walk away. And so far, we've had in a 10-year history, we've had 0 clients like that. So,
Impressive.
yeah.
So what's the name of the company?
The company is called Seniors Home Services. We're based out of Maryland.
Is
The
there a
town,
website or something that we can stream so to get more information on it?
hold on. Since I
I see
am,
seniorhomeservices.com. I don't know if that's the right website.
that should be, let me pull up my phone. Since I am somewhat challenged in the area of technology, seniors services. Um,
And tell us while we're doing that, while you're looking for that, I will stream the Juice Plus website, and you can tell us a little bit about that.
can I text message you the Juice Plus?
Sure.
And I think that would work.
Actually, can you put it over in the chat? Over in Go
The
into.
thing is that I have it on my phone. I don't have
Oh,
it.
okay. Yeah, text it to me, and I'll do my best to get it up on our website on our stream.
Okay, let's do that. Shawn. So this is the Juice Plus.
And while you're looking for that, I'm going to talk about our Medical Freedom Northwest conference that is coming up in April 20th in Spokane. We are actually doing an entire day dedicated to showing healthcare professionals how to make an income outside of the traditional insurance-based system. So it's filling up fast. The hotel blocks are already full. We do have a limited number of space, so sign up while you can. It's going to be a full day, some great speakers. If you look, Scott Jensen, Dr. Scott Jensen out of Minnesota is our keynote speaker. Dr. Kelly Victory is going to be back. It's going to be a great day. You don't want to miss out. Sign up before it is full. All right, Anna, I got your text. Keep talking, and I will try to get this streamed as you're talking.
Okay, I'm trying to text you that it's okay to give up my number if anybody wants to get in touch with me.
Okay, sounds good.
After this. But yeah, the idea of building passive income as a healthcare professional kind of entered my realm about 5 years ago. And while I had my practice in Ellensburg, I realized how important it is for physicians to kind of start thinking, well, not only physicians, any healthcare professionals, how important it is to begin thinking about something like that. Because as long as you are exchanging your time for hours in the day, it will always be a very expensive job. It's
Right.
not it's not really a business, regardless whether it's your private practice or not. But if you're the only one who is churning out any income, and when you're not there, the business can't profit, it becomes very difficult to kind of reliably build an income that's consistently coming in. So this is not something that they teach us in medical school or pharmacy school or PA school or nurse practitioner school. We're kind of trained to go out there and get a job and see however many patients or clients or
Right.
you can in a day. But I think all of us are starting to find out that it is not a very sustainable lifestyle. I think the burnout on a regular physician is something like 10 years. The ones who work in traditional healthcare system.
Yeah, you go to school longer than you practice. That's kind of sad, right?
That is right.
You don't
And
think about that.
you leave with what, 300, 400, $500,000 in loans if it's
Right.
for medical school, and then you practice for 10 years, and then either your body breaks or your nervous system breaks. It becomes kind of like one of those things. Either you get sick because you're so tired all the time, or you go through some sort of a emotional breakdown where like, I just can't do this anymore. So any healthcare provider who can start taking advantages of programs like either Juice Plus, and anyone who wants to talk to me about Juice Plus, we have a 30-year proven track record. People have made 7-figure incomes just doing Juice Plus.
So here's your website and link, and we'll also stream that link in the comments in our podcast and in our edited videos as we go along.
Thank you, and I appreciate that. Sorry, I'm kind of recovering from a little bit of a cold, so if I'm sounding like I'm under the weather, I am. Something finally got to me the past week. And the other thing for clinicians who are active in the practice, who are most likely already doing the work that Medicare is happy to reimburse them for.
Okay.
And we're talking about, and I'm being very conservative because, after my training and everything else, there's that much that I can disclose without like individually looking at the practice. But on a very conservative end, if we can bring in an extra $200,000 in Medicare reimbursement per clinician per practice, improving patient outcomes and making the workload on the office easier, it's like, really? Like, why aren't we talking more about this? And these are the services that are, especially in the remote areas where we are in, like Eastern Washington,
right?
These are extremely, extremely needed programs. So the more I kind of learn of how we can help our practitioners to kind of venture themselves maybe in different avenues and improve patient care, and at the end of the day, improve their reimbursements for the work that they're already doing with patients.
So I streamed the website there, and we'll stream that in the comments in the edited episodes. But here's your number, Anna, 509-304-9881.
Yep.
She said that that's the best way to contact her if she has any questions. If you have any questions about both these programs, what else do you want to add, Anna?
I don't know. Do you have any questions for me? I think
I do have a question for you. I ask this of all my guests as we wind up the podcast, and my question is, what do you have a passion for?
I apologize. My overall passion is, I think, wellness and whole care medicine. That's something that I became passionate about after I received my cancer diagnosis when I was 30 years old. That was an interesting part in my life where my youngest child, I have a daughter and a son, was 6 months old when I received that dreaded phone call that I'm sure nobody ever wants to hear from your physician, where you're like, oh, so we received the biopsy results, and yes, it is malignant. And you go like, my whole world kind of stopped at that moment.
Right.
The only thing I remember about that, it was like I was holding on to the kitchen counter and I was trying not to like still kind of hold it all together, and like, as a clinician, my mind went into the mode of like, what do we do next? Like, what's the next step? We do this, we do that, we do this, we do that. And the reason why I don't celebrate Valentine's Day, even though it was yesterday, was because my cancer surgery was on February 14th.
Wow.
So I just kind of wrote off that holiday out of my calendar. I was like, yeah, no, that's not something I really want to remember. Thank you, but no, thank you. And being put into the system of a traditional, my surgeon was fantastic. I went through the Seattle Care Alliance and had my surgery done at University of Washington. And I can't say that there was anything wrong with my surgeon or with anyone who was taking care of me at the time, but what I got to experience firsthand was the flavor of Western medicine that deals solely with here's a surgery, here's a medication, we can't offer you anything else.
Right.
And in my eyes was, well, I received my diagnosis before I even turned 30. I was 29 and a half. And I pretty much ate decently most of my life. I exercised majority of my life. Like, why? How did this happen? And no one could give me any answers or even turn me into any direction that would lead to any sort of health or wellness for myself and my family. As I can imagine, being a very young mother of 2 children at a time, it was scary as hell to go through that ordeal. When you're sighting on the dot of like, and I remember talking to an anesthesiologist who came into my room and he was like, kind of, trying to be positive, and I'll be an anesthesiologist and, everything is going to be fine. And I'm like, yeah. And I'm trying to joke with him. I'm like, I would be so much happier if I was scrubbing in with you on the side of working with you rather than be put under.
Rather than being the patient.
Yeah, with you. So that kind of, and also as a patient in that position, it left me sort of feeling very powerless because you can't really control anything. You're just kind of put through the mill of this is what we do. This is how this works. This is how it's going to go down. And I think that sort of opened up this passion inside of me as far as like, I like to empower people that I work with so they can start taking control of whether it's the way they provide care, whether it's the way they provide, whether it provides their income at the end of the day, whether it helps them to empower their patients to take better care of themselves. This is where Juice Plus comes in, because that stuff is like, I call them like my little magic capsules every single day. And sort of like researching the avenues of what else can we do outside of the traditional model of where we put power into the person who maybe wants to do something different as far as provide care or research other avenues of that are sort of outside, I guess, the traditional mold, for the lack of the better word.
Absolutely. Well, the goal of our podcast always has been, still is to educate and empower individuals to take charge of their own health. And that's exactly what you're talking about. And you helped us realize that goal today, Anna. So I thank you for being on. Your wisdom and knowledge was perfect for our show today. And if anybody has any questions, I streamed your phone number out there, but go ahead and give it, and we can wind this podcast up.
Okay.
So your phone number is
509-304-9881. Best way of getting a hold of me is to text me. I respond really well to text messages. And I would be happy to provide any more information if you have any, as far as Juice Plus or working with our seniors home services program. Any help that I can provide for you, even if it's just more information and you're like, well, it kind of sounded interesting, but I'm not really quite sure, that's perfectly fine. I'll be happy to get back to you.
Thank you so much, Anna, for being on our podcast today. I really appreciate it.
Thank you, Shawn.
And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Monday to our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you so much.